Which of the following is the most likely underlying pathophysiological mechanism in this patient? Autoimmune destruction of thyroid tissue, excess iodine intake, inadequate iodine intake, overproduction of thyroid stimulating immunoglobulins, or thyroid hormone resistance. So this is a 45-year-old woman presenting with a 6-month history of fatigue, weight gain, and cold intolerance. The physical exam reveals a diffusely enlarged non-tender thyroid gland, and then the lab tests show elevated TSH levels and decreased free T4 levels. So she's got symptoms of hypothyroidism, and then the physical exam and the lab tests kind of support my diagnosis of Hashimoto's thyroiditis,
Okay.
which is an autoimmune condition, um, which would not be an overproduction of the thyroid stimulating immunoglobulin. It would be an autoimmune destruction of thyroid tissue. I think that's right. It's autoimmune, so I'm gonna
All right.
go with it.
Good. This is going to be like, your Hashimoto's, right? And so this is where, it's, you have auto antibodies, right, that are attacking your thyroid and actually killing it. And just so you know, right, they don't really teach you this well, but Hashimoto has like 3 stages. Okay. So you have a hyper. So let me kind of talk to you about these kind of stages, right? You have the beginning stages is you're actually hyperthyroidism, then your euthyroid, meaning kind of like your normal.
Yeah.
Um, and then your hypo is kind of at the very end. Okay. And the reason why I kind of mention this is because, like, so think of it like this, right? You have these antibodies that attack your thyroid. So here's your thyroid, and eventually, when it starts attacking, right, you'll actually leak out T3 and T4, right?
Yeah.
So when you leak out T3 and T4 initially, then you're going to be hyperthyroid. Does that make sense? And then over
Mhm.
time, as your thyroid dies and you're leaking out only a little bit, then you're euthyroid. So then, like, your normal levels, and then after it completely dies and it can't create any more thyroid hormone, you become very hypothyroidism. So just kind of remember that that's going to be kind of your progression. Okay.
Okay.